Friends, understanding quarantine, isolation, physical and social distancing in a pandemic like today is very, very important for everyone. So friends, together let us find out some very important points about these terms. Question number 1. What does quarantine mean? Answer. Friends, quarantine is a state, period or place of isolation in which people or animals that have arrived from somewhere else are being exposed to infections or contagious disease are placed. According to Cleveland Clinic's data, which is one of the world's renowned healthcare organization in Ohio, America, governments use quarantines to stop the spread of contagious diseases. Quarantines are for people or groups who do not have symptoms but were exposed to the sickness. Quarantine keeps them away from others so they do not unknowingly infect anyone. Quarantines may be used during outbreaks when there is a sudden rise in the number of cases of a disease. Epidemics similar to outbreaks but generally considered larger and more widespread. Pandemics larger and larger than epidemics, generally global in nature like COVID-19 or coronavirus, and affect more and more people. Friends, quarantine is for people who may have been exposed to the virus. They are asked to stay at home, as in the case with people who were repatriated from widely affected countries like China, Italy, US, Iran and Spain to stay in a government-provided facility. They are required to be in quarantine for 14 days. After that, people who still don't test positive for the virus no longer have to be in a contained environment. Question number 2. What is social and physical distancing? Answer. While it is disappointing to hear that so many sports events, festivals and other social gatherings are being cancelled, of course, there is a public health reason for these measures. These cancellations help stop or slow down the spread of disease, allowing the healthcare system to more rapidly care for those patients over time. Cancelling events that are likely to draw crowds is an example of social and physical distancing. Social distancing is deliberately increasing the physical space between people to avoid illness. Other examples of social and physical distancing is that allow us to avoid larger crowds or crowded spaces are working from home instead of the office, closing schools or switching online classes, visiting loved ones by electronic devices instead of in person, cancelling or postponing conferences and large meetings. Question number 3. What is isolation? Answer. According to Cleveland Organization's data, for people who are confirmed to have COVID-19 or coronavirus, isolation is appropriate. Isolation is a healthcare term that means keeping people who are infected with a contagious illness away from those who are not infected. Isolation can take place at home, hospital or at any healthcare facility. Question number 4. What is self-quarantine? Answer. Healthcare experts recommended that self-quarantine lasts for 14 days. 2 weeks provides enough time for them to know whether or not they will become ill and be contagious to other people. People might be asked to practice self-quarantine if they have recently returned from traveling to a part of the country or the world where COVID-19 is spreading rapidly, or if they have knowingly been exposed to an infected person. Self-quarantine involves using standard hygiene and washing hands frequently, not sharing things like towels, soaps and utensils, staying at home, not having visitors, staying at least 6 feet away from other people in their household. Once their quarantine period has ended, if they do not have symptoms, they must follow their doctor's instructions how to return their normal routine. Question number 5. What is the difference between isolation and quarantine? Answer. Isolation serves the same purpose as quarantine, yet isolation is reserved for those who are already sick. Isolation keeps infected people away from healthy people to prevent the sickness from spreading. Question number 6. Our final but the most vital question of the list. What is the science behind exact 14-day quarantine after possible COVID-19 exposure? Why not 7 days, 10 days or any other days? Answer. Many people have been asked to quarantine for a fortnight. They might be asking why 14 days exactly. Why not 7, 10 or any other days? The answer has to do with how viruses invade cells and replicate. According to Dr. Graham, a well-known virologist at the University of North Carolina in America, once a virus infects someone, a host means people or animal, it takes some time for the virus to make enough copies of itself that the host means person or animal begins to shed the virus through coughs or sneezes, for instance. This is the virus incubation period. For hosts means person or animal, it is generally the time when they are infected and when they start shedding the virus, which may be little before they start experiencing symptoms. Although 14 days is not a made-up number, here it is based on what we know so far about COVID-19 or coronavirus. And it is possible that over time we will see that number change as we learn more about the coronavirus. The 14-day rule is widespread because public health agencies around the world work together on these guidelines. So friends, if you like this video, please share it with your nears and dears because we always over knowledge and experience to others. Thanks for watching this video. Stay home, stay safe and stay blessed.